Good Samaritan Health Services has over 37 free clinics each month, but we also provide a clinic once a month just for uninsured women. These clinics provide women with gender-specific medical treatment and preventative care that they otherwise would not receive. 65% of Good Samaritan patients are uninsured women. Women without medical insurance typically put off women-specific preventative exams due to lack of resources. These women's clinics typically serve 25 patients each month and provide them with access to cancer screening and free mammograms. Remember, the only qualification is that the patient is uninsured. A successful women's clinic takes proper planning, trained volunteers, and site preparation. Without planning and volunteers, we couldn't provide the level of physical, emotional, and spiritual care that each individual needs. Each women's clinic requires 10 to 12 volunteers to operate, including one who will act as site coordinator. They will be the main point of contact between Good Samaritan and your church. Let's go over some things that volunteers need to be aware of. Closed-toed shoes are required, but remember to wear a comfortable pair. You can wear either a t-shirt with your church logo or one of our Good Samaritan shirts. Just ask your site coordinator and we will make these available. All Good Samaritan clinics are under the same laws and guidelines for HIPAA and privacy as a hospital or doctor's office. All patient information stays at the clinic. We need to comply with the same level of privacy. Always be careful when dealing with patients that others cannot hear what is being said. We are not allowed to take pictures with the patients or post content on social media. For spills, use gloves, wipes, and sprays to clean up and disinfect. In the case of an evacuation, all volunteers should be familiar with the church's safety and evacuation plans. In the event of a clinic cancellation, this is the general procedure that we will follow. Good Samaritan Health Services Administration will notify the nurse coordinator of the cancellation. The nurse coordinator will contact the site coordinators. The site coordinators will then contact the volunteers. Finally, Good Samaritan Health Services staff will contact any patients that are scheduled for the clinic. We want to make sure everyone is safe. If someone's behavior is threatening, belligerent, or if there's an injury, let the Good Samaritan staff know immediately. If you can't find a staff member, let your site coordinator know. The Good Samaritan staff will decide the next steps. One of the main points we always want to emphasize when we are training for a women's clinic is what to do if there is suspected abuse, neglect, or exploitation. The probability of encountering someone who is in a domestic abuse or similar situation is likely. All medical professionals and civilians are under the state of Oklahoma's mandatory reporting rule. This means we're required to report anyone under the age of 18 and vulnerable adults, which includes anyone who is mentally handicapped, physically handicapped, or is reliant on someone to take care of them. Competent adults do not fall under the mandatory reporting rule. If you're working with someone and suspect they may be abused, neglected, or exploited, complete your process with them. Be professional, be loving, be compassionate. When you are finished, before you take on another patient, find the nurse coordinator. Tell her about your concerns, explaining your observations and what the patient told you. The nurse coordinator will take the appropriate action. If it is a mandatory reporting issue, both you and the medical care provider will be legally required to fill out the report. Your report can be done anonymously. If the situation does not fall under the mandatory reporting rule, the nurse coordinator will talk with the patient to see if there is any additional assistance Good Samaritan can offer. We can also offer them information on how they can get help when they are ready. Most patients will receive a comprehensive breast exam during their visit. If the doctor determines a mammogram is needed, the patient will complete eligibility paperwork to qualify for a free mammogram coupon. Testimonies are a huge part of showing donors and the foundations that support us that lives are being changed. If you're working with a patient that expresses feeling blessed by what's going on at the clinic, or they have a great testimony, ask them if they are willing to fill out the patient testimony form. Now let's talk in a little more detail about the process and procedures of a basic women's clinic. When you arrive, you'll be given a name badge with a number. You'll enter this number into the volunteer iPad. This allows us to provide a report for the hours an individual has volunteered, which makes deducting mileage on your taxes easier. You'll then be assigned to a station. Patients will check in and be given a purple or pink folder based on their need for a screening mammography. It is important to write down the patient's chief complaint. Remember, this clinic is for women's health issues, and other concerns should be referred to our other clinics. The patient needs to sign their name and be shown how to fill out the paperwork. The paperwork is in English and Spanish or English and Zomi, depending on the patient's language. On the folders, there should be an indication if they will need an interpreter. Inside the folder on the left-hand side are Good Samaritan ministerial materials and a list of our other clinics. On the right-hand side are the chart documents. This includes a demographics page and a treatment consent form, which will need to be completed and signed. The treatment consent form gives permission to Good Samaritan to treat them and includes a notice of privacy practices. The folders also include a personal health history and family health history form. The very last page is for vitals and is completed by a volunteer. Finally, the folder contains a flow sheet that lays out the steps the patient follows throughout the clinic. Volunteers need to initial the flow sheet for the area they covered with the patient. This assures us the patient visited all the stations before being taken to the truck. Once a patient has filled out the paperwork and it has been checked over by one of our chart checker volunteers, the patient will be registered in our EMR system and have their picture taken. They will be asked to show their ID to make sure we register their name correctly. That way, if they go to the ER, they don't accidentally get billed because they were under a different name. They will also be given a number that they will carry with them throughout the clinic. Ideally, a patient is going to meet with an insurance screener to verify they don't have insurance and can be seen at our clinic. A representative from Tulsa Healthcare Coverage Project will meet with the patients to see if they qualify for Sooner Care, Affordable Care Act insurance, or Medicare. If the patient is eligible for coverage, they can be enrolled and it's active that day. After the insurance screening, patients will have their vital signs taken and then go to either the prayer and care room or the waiting room. Patients will turn in their charts to one of our runners. When the next exam room on the truck becomes available, the runner escorts them to the truck, where a chaperone will give them further instructions. If a patient has an abnormal breast exam, or we determine they are due for a mammogram screening, the chaperone will escort them to the room where our coupon volunteers will determine their eligibility based on program guidelines and issue a screening coupon. The coupon is given to the nurse coordinator prior to it being given to the patient. Copies of the coupon are made in case the patient loses or misplaces their copy. After they are done seeing the doctor, they will return to the waiting room. We ask that every patient remains at the clinic to wait for any medicine, lab slips, screening coupon, prescriptions, etc. We try to tell them in advance to be prepared to be at the clinic for 2 to 3 hours. Thank you for taking the time to be informed about our women's clinics. Make sure you sign the confidentiality form and the attendance form, which gives you credit for watching this video. We sincerely appreciate you and cannot express enough how valuable you are to this ministry. Honestly, we could not provide healthcare services for those who have no healthcare options without church involvement and members who volunteer. Thank you for giving your time, your resources, and all that you do. If your church is interested in learning more about hosting a clinic, please contact Debbie Burke.